Imagine this. You're standing at your kitchen counter, flipping through the mail after a long day at work. There's a thick envelope from your health insurance company. You open it expecting the usual, "This is not a bill." But what you see makes your heart stop. It's a real bill, $34,000 for the knee surgery you just had. Your group health plan, the one you've relied on for years, has denied the entire claim. That's exactly what happened to Robert, a 65-year-old who owns a small landscaping company. Robert had always paid his premiums, never missed a year of coverage, and assumed his insurance would protect him. But this time, the fine print got him. Because Robert didn't sign up for Medicare when he turned 65, his work insurance was no longer the primary payer. The insurance company said Medicare should have paid first. Since Robert wasn't enrolled, they refused to pay at all. He was left holding a $34,000 bill. That bill wiped out his emergency fund, set back his retirement, and shook his faith in the system. But that's not the only way Medicare mistakes can haunt you. Meet Elaine. She decided to wait before signing up for Medicare Part B, thinking she could enroll later with no problem. When Elaine finally did sign up, she was hit with a lifelong penalty, an extra 20% tacked on to her monthly premium. Not just for a year, for every single month for the rest of her life. That penalty will cost her thousands, money she'll never get back. These aren't rare stories. I see them every week. The rules are complicated and easy to misunderstand, but the consequences, massive bills, penalties that never go away, lapses in coverage, those are all too real. I'm Angela, and I've spent years helping Americans just like you navigate Medicare's confusing maze. Today, I'm walking you through the 4 biggest Medicare mistakes people make when working past 65. Mistakes that can cost you tens of thousands of dollars or saddle you with penalties for the rest of your retirement. By the end of this video, you'll know exactly what to do and what not to do, so you can keep your retirement plans on track and your health coverage safe. Today, I'm going to show you the 4 most expensive mistakes people make when working past 65. First, what happens if you work for a small employer and don't sign up for Medicare at the right time? Second, why staying on your large employer's plan by default can mean you're overpaying or underinsured. Third, what happens if you switch to Medicare but forget your spouse or children are still on your group coverage? And fourth, the auto-enrollment trap that costs hundreds of dollars a year if you don't need Part B yet. Plus, a bonus tip for high earners on avoiding a rule called IRMAA. Here's the truth most people don't realize. If you keep working after 65 and your employer has fewer than 20 employees, Medicare automatically becomes your primary insurance. Your work insurance will only pay after Medicare pays. If you're not enrolled, your group plan can refuse to pay at all. Your initial enrollment period runs 7 months, starting 3 months before your birthday month, including your birthday month, and 3 months after. If you enroll in the 3 months before your birthday, Medicare starts on your birthday month. Wait until your birthday month and coverage starts 1 month later. Wait until October, the last month of a July birthday window, and your coverage won't begin until December. A dangerous 2-month gap. If you miss your window without creditable group coverage, you'll face a permanent late enrollment penalty, an extra 10% for every full 12 months you delayed. Forever. Don't let that happen to you. Now let's talk about the opposite scenario. You're working past 65, but your company is big, 20 or more employees. Your group health plan is still considered primary. You can delay Medicare without penalty. But here's the trap. Too many people just stay on their work plan by default, assuming it's the best deal. Sometimes it is, but sometimes you're paying more and getting less. Let's work through a real example. Say you're 66, still working, paying $240 a month for your group health premium. Your plan has a $2,500 annual deductible and 80/20 coinsurance. You pay 20% of costs after that with a $6,000 out-of-pocket maximum. Now compare that to Medicare in 2026. Your Part B premium is $179.80 per month. Add a Medigap Plan G supplement for around $130 a month, plus a Part D drug plan for $35. Total, about $345 a month. That's only $105 more than your group plan. But here's the difference. With Medicare and Plan G, your only cost after the $270 annual deductible is nothing. No 20% coinsurance, no $6,000 out-of-pocket maximum. Plan G covers everything else. One hospital stay on your group plan could cost you $6,000. On Medicare with Plan G, $0 after your deductible. There's one more trap inside this mistake, the HSA trap. If you have a health savings account, the moment you enroll in any part of Medicare, you cannot contribute another dollar, not even to free Part A. If you want to keep contributing, you must delay all of Medicare. And be careful, Part A can be retroactive up to 6 months. Stop HSA contributions at least 6 months before you apply. So run the numbers. Compare your total premiums, deductibles, and out-of-pocket maximums. Check your medications. And if you have an HSA, plan your timing carefully. Now let's talk about a mistake that doesn't just impact you, but the people you love. Meet Sandra. Sandra kept working until she was 67. She'd planned carefully, saved consistently, and was excited to retire. She enrolled in Medicare, picked a great Medigap plan, and thought she was all set. What she forgot was that her husband Dave and their 19-year-old daughter Emily were both on her employer's group health plan. Dave isn't yet 65 and Emily is still in college. When Sandra's coverage ended, so did theirs. Suddenly, they had no insurance. It took weeks of frantic phone calls to find new coverage. There were gaps, weeks with no health insurance at all. During that time, Dave had a minor heart scare. He ended up in the emergency room and the bills piled up. All because Sandra didn't realize that switching to Medicare would end her family's group coverage. Here's how to avoid it. If you have a spouse or dependent children on your employer plan, you need a transition plan before you retire. Medicare only covers you. Your spouse under 65 and children under 26 will need new insurance the moment your group plan ends. Options include the health insurance marketplace, coverage through their own employer, or COBRA for up to 18 months. But remember, COBRA does not count as creditable coverage for Medicare purposes. Start planning 60 to 90 days before you want your Medicare to begin. You'll need 2 forms. First, the CMS-L564, filled out by your employer confirming your coverage dates. Second, the CMS-40B, your application for Medicare Part B with your desired start date. Submit both to your local Social Security office before your group coverage ends, and make sure your spouse or children have their new coverage lined up at the same time. If they're going on an ACA plan, loss of group coverage is a qualifying event, but they only have 60 days to act. Sandra and her family learned this the hard way. You don't have to. Here's a scenario that surprises many people. You're still working, happy with your group insurance, and then one day a thick envelope arrives from Social Security. Inside is a red, white, and blue Medicare card. You didn't apply for it, you didn't ask for it, but there it is. This happens automatically if you're already receiving Social Security retirement benefits before age 65. Social Security enrolls you in Medicare Parts A and B 3 months before your 65th birthday, and the Part B premium is automatically deducted from your Social Security check. If you don't want Part B yet, maybe you're still working for a large employer, or you want to keep contributing to an HSA, you must actively decline it. Look for the instructions on the back of the letter and complete Form SSA 1763 at your local Social Security office. Return it before your coverage begins, or you'll be charged premiums you didn't need to pay. Now for our bonus tip, IRMAA. If your income 2 years ago was above $103,000 for individuals or $206,000 for married couples, you'll pay more than the standard Part B premium. At $250,000 joint income, your Part B premium jumps to about $259.60 per person per month, nearly $2,000 more per year per couple. If your income has dropped since then due to retirement or another life change, you can appeal using Form SSA 44. So let's recap. 4 mistakes to avoid when working past 65. First, not enrolling in Medicare on time with a small employer. Your claims can be denied and penalties last forever. Second, staying on your large employer plan without comparing real costs. Medicare with Plan G is often the better deal. Third, forgetting your family loses coverage when you switch to Medicare. Start planning 60 to 90 days early. Fourth, being auto-enrolled in Part B when you don't need it yet. Decline it immediately or you'll pay for nothing. If this video helped you, please subscribe and turn on notifications. Next week, I'm comparing Medicare Advantage and Medigap Plan G side by side. 2 plans that could save you thousands depending on your situation. You won't want to miss it. I'm Angela. Take care of yourself, and I'll see you next week.